Dr David Oehme here. I'm a neurosurgeon and spine surgeon based in Melbourne, and today I'm going to talk about the risks of anterior cervical spine surgery. Now, if you haven't seen my other videos on this topic where I talk about the indications for and what the surgery involves, please check them out on my channel. Today I'm just going to focus on what the specific risks are of anterior cervical spine surgery. Now, this is surgery where we approach the spine through a small incision in the neck. It's a really elegant way to approach the spine and allows us to get access to the front of the cervical spine and the discs, and usually when we're doing this surgery it's before a cervical disc herniation or other pathology in the anterior cervical spine. There are a lot of very important structures in this region. Theoretically, any of them could be damaged, but the reality is this surgery is performed very commonly and very safely in most patients. If we talk about the general risks of having anterior cervical spine surgery, infection is less than 1%. It's very uncommon to get an infection in this area. Equally, we don't typically get a lot of bleeding with this operation, so it's quite unusual to need a blood transfusion. Common complaints after the surgery are, I've got a sore throat, I've got some mild difficulty swallowing, I feel like I've got a lump in my throat. And this is related to the fact that when we approach the spine, we do retract on your esophagus or food pipe and your trachea, which is the windpipe that goes to your lungs. This leads to a transient difficulty in swallowing. You feel like you've got a sore throat or an upper respiratory tract infection. This typically lasts a couple of weeks to a month or so and slowly improves with time. The other common complaint after the surgery is pain between your shoulder blades. This is related to stretch in the joints at the back of the spine. There's a nerve that goes to your voice box. Now, this can be stretched. It's called the recurrent laryngeal nerve. Now, if this is stretched, it can lead to a transient lowering of your voice. Now, if you're an opera singer, this is a disaster, but for most patients, it's something that they can tolerate and should improve with time. In less than 1% of patients, this can be permanent. One of the complications that patients worry about is damage to either the spinal cord or the nerves that go to your arms. If the nerves that go to your arms are damaged, this can cause problem with pain in the arm, numbness or tingling or loss of feeling, or worst case, weakness in the arm. Fortunately, this is a very rare complication and occurs in less than 1 in 1,000 patients. The other big risk that patients worry about is damage to the spinal cord, which is obviously a very bad complication. Fortunately, this is extremely rare and occurs in less than 1 in 10,000 patients. The other complications of anterior cervical spine surgery are somewhat delayed and really depend on the operation that's done. If we do an anterior fusion, there's 2 risks. One is that the fusion doesn't take. Now, this can lead to longer term neck pain. Fortunately, in the neck, the risk of getting a non-union or the fusion not taking is very uncommon. The other risk is what we call adjacent segment disease. So when we do a fusion in one level, it puts stress on the level above and below, and that level can wear out over time. There's approximately a 10% chance of having a problem at another level in the spine requiring surgical intervention. Patients are in hospital for 1 to 2 days after anterior cervical surgery, and it's very well tolerated. Patients typically do not have a lot of pain after the surgery. In terms of its effectiveness, it's not really an operation designed to help with neck pain. Most of the time we're doing the surgery to relieve the symptoms of nerve pain or pressure on a nerve from a herniated cervical disc. If you want more information about the complications of anterior cervical spine surgery, check out my website www.doneurosurgery.com.